Hi, my name is Andi. I'm an emergency medicine physician and an associate professor at the University of California, San Francisco. I also am the director of the UCSF WHO Collaborating Center for Emergency and Trauma Care, and I'm really excited to be here with you guys today. In my career, the moment that I've been the most proud of my contribution to the efforts to alleviate suffering from snakebite was actually when I was faculty in the residency program in Tanzania. And watching my residents deliver appropriate evidence-based care to snakebite victims in the emergency department there. There are a lot of misconceptions around treatment of snakebite, and seeing my residents deliver evidence-based care, quality care to these patients, and then also watching them teach junior residents and students the appropriate way to manage snake bites in a safe and caring way in the emergency unit was really rewarding. With regards to alleviating suffering from snakebite, I think the two most important elements are one, improved access to emergency care in low resource settings, and then two, improved access to antivenom in low resource settings. Snake bites often happen in rural areas. When they occur, they're in places that are far from medical care. So when the victims of snakebite do actually get to emergency care, oftentimes the providers haven't been trained in recognizing emergencies, and sometimes not in recognizing snake bites. So it's really important that that first level provider can recognize the signs and symptoms of snakebite, can treat it appropriately, and if needed, if antivenom or other advanced treatments are needed and not available, be able to refer that patient to the appropriate level of care quickly. Once the patient gets to that appropriate level of care, it's vital that appropriate antivenom is available. Antivenom is very challenging to get in low resource countries, primarily because it's expensive. It's also, the antivenom has to be appropriate to the types of snakes in the region. It has to be stored in a specific way, and it has to be the right potency. So sometimes antivenom, if it's not potent enough, it can take 20, 30 vials of antivenom, which can bankrupt the patient and run the hospital out of its store of antivenom. So having access or in low resource settings to quality antivenom is really, really important.